everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we'll discuss all types of blood tests in detail. You may have confusion when and 5 blood tests done and for what infection which test is done. If in tests report level increased or decreased means what happens. We'll discuss in detail in this class. More than 25 tests. Your all doubt gets clear. Who all have visited first time on this channel, please do subscribe and watch. We'll see first here basic test. Here we are going to see all the tests in that test name, normal range, high level condition, low level condition, and then when the test is done. We are going to discuss these points in all types of blood tests. We'll see the basic test. First one, complete blood count. Here CBC. Test components here WBC, RBC, hemoglobin, hematocrit, and then platelet count. Here normal range of this WBC is 4000 to 11,000 per mm cube, and then RBC is 4.5 to 6 million per mm cube. It is male, in male that is 4.2 to 5.4. It is in males and then it is in females. And then comes to next one, that is hemoglobin. Here 13 to 17 gram per dl, that is in males, and then comes to the females, that is 12 to 15 gram per dl, we can see. And then platelet count is 1.5 to 4 lakh per mm cube. And then next we'll see if this level, if this CBC level increased means what happens to the person. Changes. Here WBC increased means infection, leukemia can be, and then RBC increased, polycythemia, and then platelets increased means thrombocytosis, we can say. And then comes to the low level, that is when that CBC count decreases, that time what happens? If WBC decrease, viral infection, bone marrow suppression, and then RBC, anemia, iron or B12 deficiency, we can see in the patients. And then platelets count decreases in the sense dengue or bleeding disorders, we can see. Next we'll see when that CBC test is done. When the person is having fever, fatigue, blood loss, infection, and then pre-surgery screening. We'll move to the next test, that is HB, hemoglobin. Here function of HB is carries oxygen in blood. Here we can see the normal range. Male 13 to 17 gram per dl, and then female 12 to 15 gram per dl. Next we'll see if HB increases in the person, what happens? Dehydration, COPD, chronic obstructive pulmonary disorder, we can see, and then smoking. Next comes to the low levels. When that HB decreased, the person goes with anemia, blood loss, and then kidney diseases. Next we'll see when that HB test is done. Pale skin, fatigue, pregnancy screening, and the nutritional deficiency. We'll move to the next one. ESR, erythrocyte sedimentation rate. Here ESR function is to detect inflammation in the body. Here we can see normal range 0 to 15 mm per hour, it is in men, and then in the female 0 to 20 mm per hour. Next, ESR increased means the person may get tuberculosis, rheumatoid arthritis, and then autoimmune diseases. And also low level polycythemia, we can see, sickle cell anemia, we can see. When ESR test is done, long-term fever, if the person is having long-term fever or joint pain or inflammation. Next one is a FBS, fasting blood sugar. Here the function, it measures glucose level in fasting state, and the normal range is 70 to 99 mg per dl. This is fasting blood sugar. And then if it is increased, diabetes, stress, Cushing syndrome, we can see. And then if it decreased, insulin overdose, fasting, and then Addison's disease. When this test is done, diabetes diagnosis, weight loss, frequent urination, and then blood vision. Next test, liver function test. Here components are ALT, AST, ALP, bilirubin, albumin. Here ALT, that is alanine aminotransferase, and then aspirate aminotransferase, and then alkaline phosphate here, this one, and bilirubin and albumin. These are the components. And the normal range we can see ALT is 7 to 56 unit per liter, and then EST is 10 to 40 unit per liter. Bilirubin total, that is 0.3 to 1.2 mg per dl, and then albumin level is 3.5 to 5.0 gram per dl here. These are the normal range. If this level increased means hepatitis, fatty liver and cirrhosis we can see. And then low albumin, liver failure, malnutrition we can see here. And then here LFT when it is done in the case of jaundice, alcohol abuse, and then abdominal pain. We'll go to the next one, that is kidney function test. Kidney function test. Here components are creatinine, blood urea nitrogen. Here normal range is creatinine 0.6 to 1.2 mg per dl, and then blood urea nitrogen is 7 to 20 mg per dl. If this level increased, high levels in kidney failure, dehydration, and then urinary tract blockage we can see. And then if it is decreased, low levels, muscle wasting, liver disease we can see. And then here kidney function test when it is done in the case of edema, high blood pressure, diabetes, and then urinary problem, that is urine problem. Next one is TSH, that is thyroid stimulating hormone test. Here normal range is 0.4 to 4.0 mu unit per liter. And then if it is this level increased means we can see in the case of hyperthyroidism, weight gain, fatigue and constipation. And then low levels, that is hypothyroidism, weight loss, anxiety and tremors we can see. And then this when this test is done in the sense weight changes, if the person getting changes his weight in the sense that time, and then irregular periods and then hair loss. Next one is C-reactive protein. Next test is C-reactive protein. Here normal range is less than 1 mg per liter. And then if this C-reactive protein, this protein level increased means high levels, what happens to the person? Infection, inflammation and the heart diseases. And then if it is decreased, no active inflammation. And then when it is done in the condition of autoimmune diseases and then post-surgery complications. We'll see the next one, that is vitamin D test. Your normal range is 20 to 50 ng per ml. If this vitamin D level increase means overdose of supplements, yes of course. And then if it is a low, weak bones, depression and muscle pain we can see. And then when this test is done in the cases of bone pain, in case of bone pain, tiredness and then low calcium. Next test is serum calcium. Normal range is 8.5 to 10.5 mg per dl here. And then this serum calcium level increase means what happens? High levels, bone cancer, in the case of bone cancer we can see, and then hyperparathyroidism. And then if it is a low level, vitamin D deficiency and then kidney disease. These are common. And then when this test is done, in the case of muscle cramps, bone problems and then tingling sensation. Next test is HbA1c, that is glycated hemoglobin. Normal ranges, normal is less than 5.7%. And then pre-diabetes is 5.7 to 6.4%. And then diabetes is greater than or equal to 6.5%. If this level is increased means we can see here poor diabetes control and then long term high sugar. If low level, frequent hypoglycemia we can see. And then when this test is done in the sense for diabetes diagnosis or 3 months average sugar in patient. Next test is serum electrolyte. Here normal range is sodium 135 to 145 MEq per liter, and then potassium 3.5 to 5.0 MEq per liter, and then chloride this 96 to 106 MEq per liter. This is all about the normal range of potassium, sodium and chloride. Next, if this level increased, we can see dehydration, kidney problems. If this level decreased, we can see vomiting, diarrhea, fluid loss. And then when this test is done, weakness, in the case of weakness, confusion, heart or kidney issues. Okay, next test is serum ferritin. Here, serum ferritin. That is normal range in men 24 to 336 Ng per ml, and then women 11 to 307 Ng per ml. If this level increased, we can see hemochromatosis, that is increased level of iron, and then liver disease. If this decreased, iron deficiency anemia, we can see. And then when this test is done in the sense iron deficiency, fatigue and hair loss. Next we'll see that lipid profile. Here lipid profile, normal range is total cholesterol, that is less than 200 mg per dl, and then HDL is nothing but a high density lipoprotein, that is greater than 40 mg per dl, and then low density lipoprotein LDL, that is less than 100 mg per dl, and then here triglycerides, that is less than 150 mg per dl. This is normal range we can see. If this level is increased, we can see in the patient atherosclerosis, heart attack risk, and then this if low level HDL, that is high density lipoprotein, risk of heart attack we can see. When this test is done in the sense heart risk assessment, obesity and diabetes. Okay, next we'll see the prothrombin time, PT. Prothrombin time, normal range is 11 to 13.5 seconds here. And then if this level increased, high level means liver disease, vitamin K, and then blood thinner overdose. And then if it is low level, risk of abnormal clotting we can see. And then when this test is done in the sense bleeding, in the case of bleeding disorders, before surgery, and then warfarin monitoring. Next we'll see the another test, that is D-dimer test. Here normal range is less than 0.5 microgram per ml, gram per ml, and then this level increase means blood clot we can see, DVT in the sense deep venous thrombosis we can see, pulmonary embolism we can see, and then some COVID complications. And then if it is in a low level, it's a normal. And then when this test is done in the sense in the case of leg swelling, chest pain, and then shortness of breath. Okay, we'll see the next test, that is anti-HCV, that is only hepatitis test. Here result, if this is a negative, no infection. If this is a positive, of course there is a hepatitis C virus is present. And then when this test is done in the liver symptoms, in the cases of liver symptoms, and then abnormal liver function test. Okay, next we'll see the another test, that is HIV test. Here ELISA, that is enzyme linked immunosorbent assay. Here we can see the result. Okay, non-reactive means negative, reactive means positive, and then had to confirm with Western blot or PCR. Here when this test is done in the sense before surgery, high risk behavior, and then prolonged illness. Next one is a Vidal test. Here normal, that is no agglutination or titer, that is less than 1:80, that is agglutination, no agglutination or titer. And then positive test means typhoid fever. Positive means it indicates typhoid fever. When it is done, prolonged fever, in the cases of prolonged fever, abdominal pain, and then diarrhea. Next, we'll see the ASO titer, that is anti-streptolysin O. This is in a normal range here, less than 200 IU per ml. And then if it is this level is increased in the sense rheumatic fever, strep throat infection we can see. And then when this test is done in the sense joint pain and then recent sore throat and then suspected rheumatic disease. Next one we can see here, that is procalcitonin. Procalcitonin normal ranges less than 0.1 ng per ml. And then high level, the procalcitonin level increased in the sense severe bacterial infection we can see, and then sepsis. If it is low, normal or viral infection is present. And then when this test is done in the sense fever with suspected sepsis or serious bacterial illness. Okay, next one, troponin I, troponin T. These are the proteins found in the heart muscle. Okay, normal ranges, that is less than 0.04 ng per ml. If this level increased, heart attack, cardiac injury we can say, and then low level means it's a normal. And then when this test is done in the sense in the cases of chest pain, suspected heart attack we can see. Next test is LDH, that is lactase dehydrogenase. Here normal range we can see is 140 to 280 unit per liter. And then this LDH level increased in the sense tissue damage takes place, liver disease, heart failure, and then anemia we can see. If it is in a low level LDH, rarely significant it is. And then when this test is done in the sense to detect tissue damage, cancers, and then hemolysis. Okay, next we'll see the test, that is amylase. Here normal range is 30 to 110 unit per liter. And then if this amylase level increased in the sense pancreatitis we can see, gallbladder issues we can see. And then if it is in a low level, pancreatic damage. And then when this test is done in the sense abdominal pain in the case of vomiting. Okay, next test is lipase. Here normal range is 0 to 160 unit per liter. Okay, this level is increased. That time we can say acute pancreatitis. And then low level chronic pancreatitis or cystic fibrosis. And then when this test is done in the sense severe upper abdominal pain. Okay, next test, serum bilirubin, direct plus indirect, direct including indirect. Normal ranges total is 0.3 to 1.2 mg per dl, and then direct in the sense less than 0.3 mg per dl, indirect in the sense less than 1.0 mg per dl. And then this serum bilirubin increased means what happened? The person may undergo jaundice, liver damage, bile duct blockage. And then if it is in a low level, not usually concerning. If it is low means it's not concerning, not concerned. And then when this test is performed, yellow eyes or skin or liver symptoms. Okay, next one is a alkaline phosphate, ALP. Normal range is 44 to 147 IU per liter. And then here, if this level increased means bone disorders we can see, liver disease, bile duct blockage. And then if it is in a low level, malnutrition or hypothyroidism we can see. And then when this test is done in the sense in the cases of bone pain and then liver issues. Next we'll see that this one, serum uric acid. Here normal range is male is 3.4 to 7.0 mg per dl, and then female is 2.4 to 6.0 mg per dl. And also we can see here if this level increased, we can see gout. Gout is nothing but it's a blood test to measure the concentration of uric acid in blood. Okay, gout, kidney stones, and then renal failure. And then if it is in a low level, we can see liver disease here, liver disease, and then SIADH, that is nothing but it is a series of blood and urine test that includes serum osmolality, serum sodium, and then renal function test. It's including. And then when this test is done in the sense joint pain, gout suspicion. Okay, next one, thyroxine. Next test is thyroxine. Here normal range is 5.0 to 12.0 microgram per liter, sorry, per dl. And then if this level is increased in the sense hypothyroidism, if it is in a low level, we can see the hypothyroidism. When this test is done in the sense weight change, fatigue, and then thyroid symptoms. Okay, next test. This is the last but not the least, tridothyronine, T3 level. And then here normal range is 80 to 200 mg per dl, and then this level increased in the sense we can see the hyperthyroidism, and then also Graves disease. Here it is a Graves disease is nothing but it's an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, causing it to produce too much thyroid hormone. Graves disease. And then this the hypothyroidism. And then when this test thyroid stimulating hormone test is abnormal, level is abnormal, that time we can do this tridothyronine test. I hope you all are very clear with all types of blood tests. Please like, share and subscribe to our YouTube channel for more informative content. Thank you for watching.